Again, who cares? That's the rank and file. I mean, the masses. Joining me now from Washington is healthcare policy analyst Dr. David Hogberg from the National Center for Public Policy Research. I tried to pose this one, David, that we always look at the masses as the beneficiaries of all the really smart people in Washington. I posited it's the other way around, that the elites benefit by growing government and forcing the masses into contract.
Oh, I think you're right. I mean, I think the biggest beneficiaries of any sort of government expansion are the politicians who get to hand out the benefits, but at the same time, corral votes, so to speak. That is, it makes it easier for them to get reelected. Now, that has not happened in the case of Obamacare so far, but it certainly could at some point down the road.
They can't really make Medicaid work. Medicare is going to go bankrupt. The VA is in complete disarray. They're cutting back on TRICARE. Now they want amnesty so they can add people to the Obamacare rules. How do you expand the masses and the government when you can't even work with the population you have?
Well, I mean, you don't really. What you do is you have laws like Obamacare, which turn out to be disasters. I mean, something that I think what we're seeing here is sort of the end point of the saying, if something can't go on forever, it won't. All these things could go on for a while, but when you're running huge deficits, when entitlement programs are set to explode and there's no relief in sight, at some point you can't keep adding on more and more government benefits without possibly putting the country, or at least the government, into a financial collapse or ruin.
What about this Urban Institute report on the funding gap, that hospitals don't really know what they're going to do with themselves when the reimbursements drop in the coming years? I mean, we've got ourselves addicted to these price distortions. They're the new normal. Now these distortions are kind of being more distorted, I guess.
Well, absolutely, and who knows how the hospitals are going to react if these cuts come in Medicaid or Medicare. Then hospitals will prioritize patients with private insurance. That's ultimately what's going to happen. And the problem is, one of the tragedies of this is that the Medicare or Medicaid patients won't realize, they'll be unaware that it is the policies in Washington that are affecting their care and affecting it negatively.
But won't they just be encouraged to take a subsidy and get on Obamacare, and then they'll get the priority status of somebody with so-called private insurance?
Well, I don't think people with Medicare are allowed on the Obamacare exchanges, especially if you're over age 65. And for Medicaid, there's income limits. So if you're below a certain income level, you're not going to be able to get on the exchanges.
Oh, hold on, Dr. Hogberg. I got it. This mess is so big, we need single payer, right? I mean, you can't go from Medicare to Obamacare. You just said it, there's income limits for Medicaid. Wouldn't it just be easier if we had one single payer for all of the health care needs of the masses?
Well, it wouldn't work out so well for the sick. I mean, if you like what's happening at the VA, if you like say the British system where people have to wait a long time for cancer treatment, heart surgeries, joint replacements, and so forth, then you'll love single payer. This is one of the problems with any sort of healthcare system run by government, is that the sick, the people who are truly sick, don't have much in the way of political clout. They don't amount to a lot of voters because very few people get really sick each year. And they're not doing the sort of things, the organizing, the protesting, and so forth, that can affect public policy. That's why you see these waiting lists in Britain. That's why you see all these problems, especially with the Veterans Administration, because there's not enough pressure on politicians to make the changes that would improve the system.
But isn't it very easy for people like Nancy Pelosi, who were playing a clip earlier in the monologue, to just say, well, we'll fix it eventually. I mean, we know it's really good. None of us want to be on it. Isn't it really easy for the politicians to talk about how wonderful their ideas are when they don't have to live with them?
Oh, of course it is. I mean, Nancy Pelosi, I'm sure, could get insurance via her wealthy husband. In fact, I think she's over 65, so, you know, if she's not on Medicare at this point, I would be actually a little surprised. But of course, I mean, you know, Nancy Pelosi is going to keep getting reelected from that district regardless of what happens with Obamacare. So, yeah, it's often very easy for politicians to do this. And one of the things politicians learn over time is that they can get away with these sorts of things. I mean, yeah, they have to face some difficult questions from reporters. Yeah, maybe a few politicians sort of in swing districts or swing states might lose their job, but most of them won't. And so, you know, what they learn is they can weather the storm and get away with it.
And in the end, socialism is for the people, not the socialists. David, thank you so much for joining me tonight. Coming up